An article called The Death Treatment, written by Rachel Aviv for the New Yorker magazine, states the Right to Die movement has gained momentum at a time of anxiety about the graying of the population. People who are older than 65 represent the fastest growing demographic in the United States, Canada, and much of Europe. Euthanasia is not a choice or a humane act. It is legalized suicide and murder. The Family Research Council cites there is no such thing as a life not worth living. Every life holds promise, even if disadvantaged by developmental disability, injury, disease, or advanced aging. In 1997, the United States Supreme Court ruled that death was not a constitutionally protected right, but also recognized that citizens have legitimate concerns about prolonged deaths in institutions. This left the individual states with the task of resolving questions. Oregon was the first to pass a law allowing doctors to prescribe lethal drugs. Similar laws for assisted suicide have also been adopted in Washington, Montana, Vermont, and most recently California. The idea of euthanasia seems to be gaining momentum worldwide and in the United States. The Netherlands was the first country to legalize euthanasia. In 2002, Belgium became the second country in the world to decriminalize euthanasia, followed by Luxembourg in 2009, and most recently, Canada and Colombia. Euthanasia-related deaths have doubled in the Netherlands over the past 5 years and increased by more than 150% in Belgium. We cannot deal with the problems of human beings by killing them. Assisted suicide is being marketed as a step toward individual freedom, but falsely places pressure on people with chronic illness or disabilities. Legalizing euthanasia could have profoundly detrimental long-term effects that cannot yet be envisioned. Patients can be euthanized even if they do not have a terminal illness in Belgium and the Netherlands. In 2014, 13% of patients euthanized were not terminally ill, and 3% suffered psychiatric disorders. Some prominent media outlets have adopted a mostly uncritical approach to euthanasia, deeming people courageous who have chosen to die. One newspaper published a long tribute to a depressed mother who chose to die. She had been abandoned by her boyfriend and became disillusioned by her psychiatric care. People have been euthanized in Belgium for disorders such as autism, anorexia, chronic fatigue syndrome, and partial paralysis, as well as other disorders. Studies in Oregon and Switzerland show that people requesting death are more motivated by the desire to remain independent than by physical pain. Our society should focus more on compassionate care for the dying with adequate pain control and education. The suicide rate in Belgium is the second highest in Western Europe. This excludes cases of euthanasia. On the subject of euthanasia and assisted suicide, the chairman of Belgium's largest medical association cautioned against making, quote, the exception the rule, end quote. Especially considering the fact that Belgium, as mentioned, has the second highest suicide rate in Western Europe, this seems like sound advice. Secular humanism, one of 7 belief systems recognized by the Belgian government, views the right to a dignified death, euthanasia, or assisted suicide as an accomplishment. The Belgian government has even paid for humanist counselors. In addition, children in grades 1 through 12 are taught humanist values using a course defined as non-confessional ethics. Google describes secular humanism as humanism with regard in particular to the belief that humanity is capable of morality and self-fulfillment without belief in God. Is leaving God out of our lives really a good idea? We may not understand why some circumstances happen in life, but personally I would rather rely on God than my own understanding. Opponents of euthanasia and assisted suicide consider euthanasia a slippery slope. Laws in the Netherlands over the past 20 years have evolved from euthanasia of terminally ill patients to chronically ill individuals, and even from physical illness to psychological distress. Voluntary euthanasia has evolved to conditional acceptance of non-voluntary and involuntary euthanasia. Where does the madness end? By legalizing euthanasia and teaching secular humanism to children throughout their life, how can we even possibly know what will become the norm a generation or 2 from now? We may not be able to comprehend the detrimental long-term effects yet to be envisioned. As this very scary trend permeates throughout the United States, perhaps we should ask ourselves, why are we so quick to dismiss God from our lives and our world? Do we really want the concept of euthanasia to morph into what has transpired in the Netherlands? Perhaps if we were more willing to keep God in our lives, there would not be such a fascination with death. On the website euthanasiaprocon.org, Wesley J. Smith, legal consultant for Patients' Right Council, sums it up best. If we legalize assisted suicide, some patients will die instead of ultimately regain their joy in living. Doctors prescribed death is not death with dignity. It is really the euthanasia of hope. Palliative care, or care focused on quality of life for patients and their families, should be enhanced and supplemented. Perhaps the angst propelling the euthanasia movement would diminish if more and greater access to palliative, psychological, and physical care was provided. Even though the Right to Die movement has gained momentum because of the growing population that is 65 or older, it is the concerns of the younger generation, not the desires of the elderly, that seemingly motivate the laws regarding euthanasia. Members of younger generations derive comfort from thinking they can control the end of their lives. Thank you.